Hi everyone, in this video we are doing a neurotoxin treatment. We are starting on the lateral portion of that patient's frontalis. And for this patient, I did not mark. I have been treating her for quite a while now, so I don't have the need to. Once I have an estimated treatment plan, I just have the patient animate and I can follow that muscle movement, and that's how I know where I'd like to place my units. But I am just pulling taut. This patient is a frequent neurotoxin patient as well. She comes pretty regularly, every 4 to 5 months. So she is showing some signs of atrophy in that frontalis. So as you can see, as she elevates up her forehead, there is not significant movement. Just because that movement is settled and that muscle has atrophied, it doesn't necessarily change my unit dosing because dose is duration of that treatment. However, I do start to recommend that the patient wait a little bit longer in between treatment times. So, for example, for this patient today, we had the conversation of this time she went 4 months in between treatments, but we are going to try for around 5 to 6 months. Of course, the patient can always let me know if that movement comes back sooner, but she's seeing some atrophy here, so I did recommend that we just wait a little bit longer in between treatments. Moving on to her glabella, I am injecting deep here and just holding a gentle pinch. And same thing for my medial corrugators as well. I'm looking for that pull right by the 11 line. I am injecting deep towards that brow bone for the insertion point of our corrugator. And same thing for this side as well. I am just holding a gentle pinch and I am injecting deep, 3/4 to full needle depth here. We are also going to be treating the lateral tail of her corrugator as well. This is a more superficial injection, so I'm looking for that little pull. It looks like a little chevron, a little inverted triangle. I'm looking for that tail end of the corrugator to inject. Again, just a gentle pinch, and I am injecting superficial. Again, you can appreciate the atrophy that she has developed here. So again, we probably will wait just a little bit longer in between her next treatment. The minimum time in between treatment is 3 months. That is just the minimum amount of time you have to wait to be treated again to avoid developing any sort of resistance. But for many of my patients, I am waiting much longer than 3 months in between treatments. The goal of neurotoxin is to see relaxation in the wrinkles. So as long as we have that relaxation, the treatment is still working. The goal is not to have a frozen appearance or not be able to move your muscles at all. The goal is just to maintain wrinkle prevention. So that does not mean that they have to come in every 3 months. But for my crow's feet, I am injecting away from that eye. I want to see that little bump or that little bleb form. It's a pretty superficial injection here. We are treating a little bit of those fine lines underneath her eye as well. You will never be able to completely still this lower portion because it is, functions with our smile. And we don't want to affect the smile, so that lower portion can be a little bit tricky to inject. And we are finishing off with a brow lift on this side as well.